Good morning and welcome to UroNurse News. I'm Vic Senese. Don't forget to like and subscribe. Today's topic may upset you if you're not the firstborn in your family, which I am. I examine a compelling new body of research exploring a question that sits in the intersection of pediatrics, neuroscience, and family dynamics. Does birth order influence neurodevelopment in the first year of life? Are firstborn children really smarter than their siblings? As a firstborn, I say the answer is definitely yes. For decades, researchers have observed a consistent pattern. Firstborn children often outperform later-born siblings in cognitive and developmental outcomes. But the key question has always been, is it biology or environment? A new cohort study from the Japan Environment and Children's Study, or the JECS, helps bring clarity to that question. This large-scale research followed more than 2,100 sibling pairs, comparing firstborn and secondborn children within the same families. And importantly, this is within family design. That means researchers controlled for shared family factors such as socioeconomic status, genetics, and household environments. Infant neurodevelopment was assessed using the Ages and Stages questionnaires, third edition ASQ3, at both 6 months and 12 months of age. Now, they examined key domains including communication, gross motor skills, fine motor skills, problem solving, and personal social development. They also measured something critically important, parental engagement. This included playtime, reading aloud, and outdoor interaction. So what did they find? At 6 months of age, second-born children scored lower across multiple developmental domains compared to firstborns. Differences were seen in communication, motor development, and especially personal social skills. In some cases, the gap reached nearly 14 points in early social developmental measures. At 12 months, the pattern continued, but with a nuance. Some differences remain, particularly in fine motor and social domains, while others like communication and problem solving became smaller and statistically less significant. Now here is one of the most important findings. Parental engagement scores were lower for second-born children. The difference was modest but consistent, about 0.77 points lower on the engagement scale. Researchers suggest this supports what's known as the resource dilution model. In simpler terms, parental time, attention, and one-on-one stimulation may be divided differently as the family size increases. Well, of course, that makes sense. But this does not mean birth order determines destiny. Far from it. Researchers emphasize that early differences may reflect environmental exposure, not fixed biologic advantage. And importantly, some developmental gaps narrowed by 12 months. Another theory, the confluence model, may also help explain this. As younger siblings grow, they benefit from observing older siblings, increased social stimulation, and broader family interaction patterns. Like all studies, there's limitations. The ASQ3 scores are parent-reported, which can introduce perception bias. And while statistically significant differences were observed, the clinical meaning over the long term remains unclear. So, what can we conclude? The study suggests that small but measurable differences in neural development may appear within the first year of life based on birth order. However, those differences are likely shaped by a complex mix of things like parental engagement, family dynamics, environmental stimulation, and the other sibling interacting with them, not birth order alone. In the end, this research reminds us of something important. Early development is dynamic, sensitive, and deeply environmental. Every interaction a caregiver has with an infant matters. And I can tell you, as a grandparent, our interaction matters too. I can tell that some of the things that my youngest granddaughter does is copying Grandpa. Especially when she takes a sip out of her cup of coffee and goes, ah. Well, she doesn't drink coffee out of her milk. Anyway, I'm Vic Senese, and thank you for watching UroNurse News. Hey, coming up this Saturday on UroPatient, hosted by me with expert urologist Dr. John Lynn, if you're dealing with weak urine flow, frequent nighttime trips to the bathroom, or even urinary retention, this episode's for you. We're going to be breaking down a critical question many men face. When prostate blockage becomes severe, What's the gold standard surgery? Is it still the traditional TURP or laser options like the HoLEP leading the way? How do doctors decide which procedure is right for you? Don't miss it on UroPatient, and Dr. John's going to break it all down for you. Tomorrow on UroNurse, I'm diving into a topic that most people have never really been taught to think about in a medical way. We explore what menstrual blood, yeah, you heard that right, menstrual blood can reveal about overall health, and why some researchers are calling it a unique biological specimen with untapped diagnostic potential. Could something so routinely actually hold early clues about hormones, inflammation, or underlying health changes? Well, then you better tune in tomorrow if you want to find out what's normal and what's not, and what the body may already be trying to tell you every month.
UroNurse News every weekday at 9 a.m. Central Time.
Breaking out, we bring it to you.